Welcome to another episode from the Veterinary Medicine Digest. Imagine, if you will, the hushed hallways of a high-stakes veterinary referral hospital where a young pug is rushed in, struggling with a sudden and unexplained loss of coordination. This is the starting point for a scientific journey into the hidden mysteries of the canine brain, where researchers are desperately searching for answers written in the delicate fluid that bathes the central nervous system. Our story today centers on the quest for biomarkers, those biological fingerprints that can tell us what is happening inside the skull when our standard imaging tools fall silent. Specifically, we are diving deep into a groundbreaking study regarding the analysis of peroxinase 1 activity in cupric, reducing antioxidant capacity in the cerebrospinal fluid of dogs with neurological disorders. To understand the weight of this research, we must first look at the landscape of non-infectious inflammatory central nervous system diseases in dogs, which frequently cause severe neurological disease and death. For decades, veterinarians have struggled with a group of conditions known as meningoencephalitis of unknown origin, which comprise a group of non-infectious inflammatory brain conditions. These diseases can be assigned to major subgroups like granulomatous meningoencephalitis or necrotizing meningoencephalitis, yet a conclusive diagnosis currently relies essentially on post-mortem histopathology. It is a diagnostic tragedy where the final answer often comes only after the patient is gone. Researchers have investigated different infectious agents, environmental triggers, and genetic influences as possible disease causes, but results have so far been inconclusive. The absence of a specific pathogenic agent or known disease trigger complicates the development of a confirmatory diagnostic test. Because clinical signs reflect the location of the lesions in the brain parenchyma, the symptoms vary considerably between cases, making every presentation a new puzzle. In both the granulomatous and necrotizing forms, the onset of disease is frequently acute and progressive, putting immense pressure on the clinician to act fast. Systemic signs such as fever or vomiting are uncommon, which means the disease often hides until the neurological signs are undeniable. A presumptive diagnosis is usually based on magnetic resonance imaging findings and cerebrospinal fluid analysis, but these are not always definitive. Despite the correct diagnosis and appropriate treatment with immunosuppressive drugs, the prognosis for these dogs is at best guarded. This is why new insights into the complex pathophysiological mechanisms and their biomarkers are so important. Biomarkers are defined as any substance, structure, or process that can be measured in the body and influence or predict the incidence of disease. A specific subcategory called diagnostic markers is particularly useful from a clinical perspective because they detect or confirm the presence of a condition. Many potential biomarkers have been explored, such as acute phase proteins, including C-reactive protein, but these are often normal in cases of meningoencephalitis of unknown origin. Antiglial fibrillary acidic protein may play a role in identifying pug-dog encephalitis, but further research is needed to establish it as a consistent marker. Increased expression of interferon gamma in necrotizing meningoencephalitis and interleukin-17 in granulomatous meningoencephalitis has been shown in tissue biopsies. Interestingly, positron emission tomography has shown promising results in detecting hypometabolic areas of necrosis and hypermetabolic areas associated with granulomas. Genetic screening for specific haplotypes might one day reduce the prevalence of these diseases in susceptible breeds like pugs and Yorkshire Terriers. Even the gut microbiome is being investigated, with high abundance of certain bacteria like Prevotella being linked to a reduced risk for developing these brain disorders. Ultimately, the goal is a single conclusive diagnostic test that currently does not exist. But the mystery deepens when we consider another major player in the field of canine neuroinflammation, steroid-responsive meningitis-arteritis. This condition causes severe inflammation of the meningeal arteries, leading to generalized meningitis and a systemic inflammatory response. Unlike the brain-focused encephalitides, this disease primarily affects the meninges and associated arteries. Dogs with this condition are common patients in veterinary practice, with specific breeds like the Bernese Mountain Dog, Beagle, and Boxer showing a high occurrence. The classic form presents with acute signs including neck pain, rigidity, fever, and a stiff gait. If not medically controlled, frequent relapses can lead to a chronic protracted form resulting in fibrosis of the meninges. This chronic form can further compromise blood flow to certain central nervous system structures, making it difficult to confirm except by post-mortem histopathology. Systemic manifestations like pyrexia and an inflammatory leukogram offer more diagnostic options than we see with brain-based inflammations. Acute phase proteins such as C-reactive protein and serum amyloid A have proven useful in the diagnosis and monitoring of this specific disease. These proteins follow the clinical course of the disease, decreasing with remission and increasing upon relapse. Increased immunoglobulin, concentrations in both serum and cerebrospinal fluid, are also characteristic of dogs with steroid-responsive meningitis-arteritis. However, a frequent problem is the inability of these markers to effectively differentiate the condition from other systemic inflammatory states like sepsis. Local production of chemokines like interleukin-8 appears to be responsible for the movement of leukocytes into the cerebrospinal fluid. Other cytokines like interleukin-6 and transforming growth factor beta have been found elevated, further supporting an autoimmune or hyperimmune etiology. Genetic factors are also suspected, with studies showing strong evidence for genetic involvement in breeds like the Nova Scotia duck tolling retriever. Interestingly, even heat shock protein 70 has been suggested as an extracellular biomarker of this immune-mediated disease. The endocannabinoid system also holds an important immunoregulatory function and shows up regulation in the serum and cerebrospinal fluid of these patients. MicroRNAs are another fast-growing field that might one day provide highly selective therapeutic targets for these neurological disorders. While magnetic resonance imaging is the reference standard for evaluating brain lesions, it is currently limited in its ability to diagnose meningitis on its own. There is a clear need for large-scale and well-defined studies to provide more evidence-based information for clinicians. Now, let us turn our attention to the physical trauma of the spine, which often involves the same biochemical battleground. Canine intervertebral disc herniation is a naturally occurring acute spinal cord injury that serves as a translational model for human trauma. Following the primary mechanical insult, secondary mechanisms of injury lead to further damage of the spinal cord parenchyma. These mechanisms include ischemia, perivascular edema, electrolyte imbalances, glutamatergic excitotoxicity, and oxidative stress. There is also strong evidence that hemorrhage in the spinal canal has an important impact on the development of secondary injury and clinical outcome. Monitoring this hemorrhage in the subarachnoidal space would seem useful to assess the injury and the prognosis. When hemorrhage occurs, rapid lysis of red blood cells releases oxyhemoglobin, which is eventually converted into bilirubin and free iron. The free iron is then detoxified by the protein ferritin. Researchers have utilized spectrophotometry to quantify net oxyhemoglobin absorption and net bilirubin absorption in the cerebrospinal fluid. In a study of dogs with intervertebral disc extrusion, net bilirubin absorption was significantly higher compared to control groups with epilepsy. Interestingly, dogs with a higher ferritin concentration in the cerebrospinal fluid actually had a better outcome. Ferritin in the spinal cord is a marker of microglia, which are important for re-establishing tissue homeostasis after injury. However, the use of net oxyhemoglobin absorption is limited due to the high risk of false results from iatrogenic blood contamination during the fluid collection. Other studies have characterized acute phase proteins in the cerebrospinal fluid following spinal cord injury. Haptoglobin concentration was significantly higher in the fluid of affected dogs compared with healthy controls. This protein is produced by the liver and oligodendroglia in response to inflammatory triggers like interleukin-6. Haptoglobin is believed to exert neuroprotective effects by binding free hemoglobin and reducing oxidative stress. Concentrations of C-reactive protein and haptoglobin were found to be higher in dogs with severe injury compared to those with mild to moderate spinal trauma. These findings suggest that acute phase proteins in the cerebrospinal fluid can be used as markers for the severity of spinal cord injury. While there was no significant correlation between these proteins and the 42-day motor outcome, the study was a vital step in understanding the secondary injury environment. This model system is particularly relevant as the expression of major acute phase proteins in humans and dogs are parallel following a variety of inciting events. This brings us to the chemistry of the hero of our deep dive, peroxinase 1. Peroxinases are a family of 3 enzymes called peroxinase 1, peroxinase 2, and peroxinase 3. They have multifunctional roles, including protection against oxidative damage, lipid peroxidation, and contribution to innate immunity. Because they perform multiple autonomous and often unrelated functions, they are considered to be moonlighting proteins. Peroxinase 1 is synthesized primarily in the liver and appears in the serum associated with high-density lipoproteins. Historically, the interest in this enzyme was toxicological because of its role in protecting against poisoning by organophosphate insecticides. More recently, research has focused on its protective role in vascular disease and its use as a biomarker for oxidative stress and inflammation. Peroxinase 1 is considered a promiscuous enzyme because it can hydrolyze a wide variety of substrates, including aromatic carboxylic acid esters and lactones. When measuring its activity, researchers can look at peroxinase activity, arylesterase activity, or lactonase activity, depending on the substrate used. Peroxin is extremely toxic and unstable, making it a challenge to work with in a laboratory setting. Phenylacetate is less toxic and is often used to measure arylesterase activity, showing a high correlation with the actual concentration of the enzyme. In humans, a genetic polymorphism at position 192 significantly affects the enzyme's activity levels against certain substrates. Individuals with the Q allele have lower enzyme activity than those with the R allele. This polymorphism leads to 3 phenotypic groups, QQ representing low activity, QR for intermediate, and RR for high enzyme activity. Interestingly, rabbits also possess a serum polymorphism similar to the human one. In pigs, phenotypes with high, intermediate, and low activity were genetically determined as well. In the human population, low peroxinase 1 activity and the QQ phenotype have been suggested as risk factors for lumbar disc herniation occurrence. This is significant because specific inflammation and oxidative stress are leading causes of disc degeneration. Reducing these inflammatory reactions might alleviate the progression of disc disease. Furthermore, peroxinase 1 has been studied in the context of human neurodegenerative diseases like Alzheimer's and Parkinson's. Decreased serum arylesterase activity might be a common denominator of neuroinflammatory and neurodegenerative diseases. Serum arylesterase levels were found to be significantly lower in patients with multiple sclerosis compared to healthy controls. These findings suggest that a depressed arylesterase activity reflects an altered systemic redox balance in various neurological conditions. However, in human multiple sclerosis patients, cerebrospinal fluid levels of arylesterase were detectable but did not significantly differ from other neurological controls. This highlights the complexity of using this enzyme as a specific diagnostic marker across different species and compartments. The plot thickens when we look at how paraoxinase 1 behaves in other systemic conditions such as canine hypothyroidism. Hypothyroidism is the most common endocrine disorder in dogs and is known to influence oxidative status. In a study evaluating redox status, researchers found significantly higher paraoxinase 1 activity in the serum of dogs with hypothyroidism compared to healthy dogs. This is a fascinating contrast to the human findings where hypothyroid patients usually show a decrease in antioxidants. The researchers hypothesized that the elevation of cholesterol in canine hypothyroidism implies an increase in high-density lipoproteins, which are the carriers for paraoxinase 1. This increase might actually be one of the reasons why dogs have lower risks of atherosclerosis than humans. The study also utilized the cupric-reducing antioxidant capacity assay to estimate total antioxidant capacity. This method measures the ability of non-enzymatic antioxidants to reduce copper ions in the presence of a chelating agent. In the hypothyroid dogs, serum cupric-reducing antioxidant capacity did not show significant differences between groups. However, oxidant biomarkers like total oxidant status and reactive oxygen-derived compounds were significantly higher in the hypothyroid group. This suggests that hypothyroid dogs are experiencing a state of altered redox balance and increased oxidant production. Saliva was also investigated as a non-invasive sample, and while some markers changed, others required correction for protein concentration to show relevance. These systemic studies remind us that the brain does not exist in a vacuum and that what we measure in the cerebrospinal fluid can be influenced by the dog's overall metabolic state. This background sets the stage for the pivotal short communication we are focusing on today, which analyze paraoxinase 1 activity and cupric-reducing antioxidant capacity in the cerebrospinal fluid of dogs with neurological disorders. Cerebrospinal fluid is in close contact with the central nervous system and is commonly used to identify pathological alterations. Pathological changes in the brain can alter the composition of this fluid, making its analysis useful for diagnosing inflammatory, infectious, or neoplastic diseases. However, routine techniques like cell counts and protein determination often yield apparently normal results. This study sought to explore whether redox markers could provide better diagnostic information for conditions like idiopathic epilepsy, intracranial tumors, and various inflammatory pathologies. The researchers included 40 animals in their study, all of which were diagnosed with a central nervous system disorder based on clinical signs, computed tomography, and basic fluid analysis. Because collecting cerebrospinal fluid from healthy animals is ethically inappropriate, the group with idiopathic epilepsy was used as a control. The inflammatory group was a heterogeneous mix of dogs with meningoencephalitis of unknown origin, steroid-responsive meningitis-arteritis, idiopathic generalized tremor syndrome, and distemper. The results were unexpected, significantly higher values of paraoxinase 1 activity were found in the inflammatory group compared to the epilepsy, tumor, and acute disc herniation groups. This higher activity in the inflammatory cases contrasts with the decreased levels often reported in human neurodegenerative diseases. One possibility is that acute or subacute inflammation triggers a compensatory antioxidant mechanism that locally increases the enzyme. Alternatively, the increase could be a result of altered blood cerebrospinal fluid barrier permeability. Elevated levels of the enzyme in conditions with marked inflammation or oxidative stress could represent a protective response. In contrast, no statistically significant differences were found in the cupric reducing antioxidant capacity values among any of the study groups. While peroxidase 1 activity was higher in samples with an increased white blood cell count, there was no direct correlation between the magnitude of the cell count and the level of enzyme activity. This suggests that the presence of inflammation is the key factor rather than the simple number of inflammatory cells. The absence of a correlation between peroxidase 1 and the total antioxidant capacity likely reflects the difference between enzymatic and non-enzymatic antioxidant responses. Despite the small sample sizes and the heterogeneous nature of the groups, these findings support the biological plausibility of oxidative stress involvement in central nervous system inflammation. This study provides a valuable foundation for future research that might determine the diagnostic and prognostic value of this enzyme over time. To place this in a broader context, we should also look at other cerebrospinal fluid markers like lactate. Increased levels of lactate are attributed to changes in brain metabolism, immune system activity, and cell death. In a prospective study, researchers found a direct correlation between cerebrospinal fluid lactate and serum lactate concentrations in dogs with neurological signs. However, no significant difference was found in the fluid lactate concentration between dogs with structural brain disease on magnetic resonance imaging and those without. This was a disappointing result for those hoping for an inexpensive screening tool to orient the clinician toward a diagnosis of intracranial disease. It suggests that routine measurements of lactate concentration in the cerebrospinal fluid are not recommended in a clinical setting. This underscores the difficulty in finding a single fluid marker that can reliably identify structural disease when imaging is unavailable or inconclusive. The search for the perfect biomarker continues as researchers explore even more modern proteomic tools. A recent study evaluated 4 homologous biomarkers: neurofilament light chain, amyloid beta 42, tau, and neuron-specific enolase. Neurofilament light chain is increased in fluid proportionally to the degree of axonal damage in a variety of disorders. Tau is an indicator of axonal and neuronal damage, with levels positively correlated with tissue damage. Neuron-specific enolase is a highly specific marker for neurons and peripheral neuroendocrine cells. In dogs suffering from meningoencephalitis of unknown origin, researchers observed elevated levels of tau, neurofilament light chain, and neuron-specific enolase, all of which were intercorrelated. Interestingly, amyloid beta 42 was significantly decreased in dogs suffering from brain tumors. This suggests a direct link between tumors and the amyloid beta pathway, potentially providing a diagnostic link. While the observed diagnostic accuracy was not yet sufficient for these to be used as routine individual screening tools, a combination of markers has the potential to improve diagnostic precision for these fatal brain disorders. The goal remains the development of blood biomarker assays for dogs, which would be far less invasive and more practical for the everyday clinician. As we wrap up this deep dive into the world of canine neurobiomarkers, the picture that emerges is one of incredible complexity and untapped potential. We see a central nervous system that is not a quiet bystander to disease, but a dynamic biochemical battlefield where enzymes like peroxidase won moonlighting as protectors against oxidative stress. We have seen how researchers are using everything from human multiple sclerosis data to the metabolic quirks of hypothyroid dogs to piece together the puzzle of the canine brain. The discovery that inflammatory brain diseases in dogs are associated with higher peroxidase, one activity in the cerebrospinal fluid, challenges our previous assumptions and opens up a new avenue for understanding how the brain defends itself. It reminds us that every fluid sample collected is a story waiting to be read. While we are not yet at the point where a single blood test can replace a biopsy or a high-tech scan, we are getting closer every day. The journey from the clinic to the laboratory and back again is what drives veterinary medicine forward. For that young pug we imagined at the beginning of our story, these markers represent a future where diagnosis is faster, treatment is more targeted, and the prognosis is no longer just a guess. We are moving toward a world of precision medicine for our four-legged companions, where the fingerprints of disease can be found in a single drop of fluid. Thank you for listening. The titles for the reference papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.